online as soon as possible. However, as of yesterday, more than 53% of people aged 18 or older have received at least one dose, and we've administered more than 666,000 doses. Yesterday, we expected to give more than 13,000 doses at sites throughout the province, and we will completely exhaust the vaccine supply that we have on hand within 5 days. As more vaccine arrives in our province, that means our operations are also accelerating in response. This week, we'll give more than 85,000 doses in super sites, pop-up clinics, urban Indigenous clinics, and through our focused immunization teams. Next week, we expect to give nearly 96,000 doses through those same channels. The Steinbach Supersite opened yesterday. It went quite well, and Gimli will open its doors on the 29th. And a new Supersite will be coming to the PAW, opening no later than June 9th. This will bring a second Supersite to northern Manitoba to complement the region's existing Supersite, as well as the many pop-ups and focused immunization teams that have administered doses across the north. You can book appointments at our super sites, at pop-ups that are running next week throughout the province, or at an urban Indigenous clinic. Today, we're announcing that the booking of second doses will launch this Friday for individuals with specific health conditions. After those with health conditions have booked their appointments or have had an opportunity to, we'll be moving to a system based mainly on when people got their first dose. For example, if you got your first dose before the end of March, you'll be eligible to book sooner. Then, a few days later, we'd move to those who had their first dose before April 5th, then before April 12th, and so on. In other words, the earlier you got your first dose, the earlier you'll be able to book your second dose. For example, healthcare workers were prioritized earlier in the campaign and will therefore be able to book earlier for second doses as we make our time-based announcements. We expect to be able to make these announcements approximately every Monday, Wednesday, Friday, starting next week. As was the case during first doses, only people who become eligible for second doses should be booking their appointments. The booking process will be the same as when booking your first dose through the call center or online, although it will be important to know which vaccine type you received for your first dose when you make your appointment for the second one. While regular announcements will be made, people are encouraged to visit protectmb.ca often or follow @mbgov on Twitter for the most up-to-date information. For those of you with older relatives who may not be online, you can add them to your online booking account and book for them once they become eligible for their second dose. You can also, of course, call the call center to make an appointment for them when they become eligible. We're still getting questions from families affected by the shift to remote learning. People continue to ask what that means if they have a vaccine appointment. If you can line up childcare for your immunization time, that's great. But if you don't have childcare, you're welcome to bring your kids with you. Just remember that they will need to wear a mask and practice good physical distancing. Last week, when we announced that youth 12 and up were eligible for the vaccine, we saw more than just under 42,000 appointments booked in one day. That is a new record for one-day appointment booking and a great sign of interest in the vaccine in Manitoba. And with that, I will pass it over to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force. As Johanu mentioned, as of Friday, May 21st, some Manitobans will be able to begin booking second dose vaccine appointments. À compter du vendredi 21 mai, certains Manitobans pourront prendre rendez-vous pour recevoir leur deuxième dose. A partir del viernes el 21 de mayo, algunas personas en Manitoba podrán comenzar a reservar citas para la segunda dosis. Our plan was to reach this milestone before May 22nd, and our team has been working so hard to make this possible. So I really want to thank all of the folks who are working in the background, doing the planning and the counting and tracking for getting us to this point. I do want to emphasize that this expansion should have no effect on our plans to get a first dose of vaccine to 70% of the population aged 12 and up by June 9th. As we announced last week, people with specific medical conditions that make them less likely to be protected after one dose will be eligible first. Comme nous l'avons annoncé la semaine dernière, les personnes ayant des conditions médicales spécifiques qui les rendent moins susceptibles d'être protégées après une dose seront éligibles en première. Como dije la semana pasada, las personas con condiciones médicas específicas serán elegibles primero. Las condiciones son las que conducen a un sistema inmunológico más débil y por lo tanto les hacen menos propensas a estar protegidas después de una dosis. A complete list and more information is available online, but the conditions include people who are on dialysis, people who have Down syndrome, people who have received or are on the list to receive an organ transplant, people who are currently receiving chemotherapy cancer treatments, and those who are living with HIV. We ask that people only book at this time if you have one of the conditions that's listed on the website. These individuals are more medically vulnerable and not only at higher risk of severe outcomes, but also less likely to be protected by one dose. I have heard that some people are worried that there won't be enough vaccine for them to get a second dose, but we've seen a consistently increasing supply of vaccine, and the federal government has made it clear to us that we will have large quantities of vaccine going into the future. So our team is confident that all Manitobans who have already received a first dose will receive a second dose. As for those who received the AstraZeneca vaccine, I'm also confident that you will be able to receive a second dose. Last week, I talked about how we changed our approach to ensure that there is supply for second doses as needed. And we're still waiting for the study results from the UK that may show whether or not we could exchange your second dose and use Pfizer or Moderna instead. As soon as we have the information from the UK study, we will share that with you. We are also in the process of adding new information to our website on the vaccine uptake by regional health authority and by health district. It will include data by age group and by sex, as well as by first and second doses. This will help us to monitor where we are doing well and where we need to do more outreach. With this kind of data, we can better tailor our communications, and we can work to reach more Manitobans and encourage them to be vaccinated. As we study how we can use vaccines, we also want to learn more from you, from Manitobans, and how you feel about the vaccine. And that's why we're launching a public engagement campaign to better understand people's personal experiences with COVID-19. We'll also be asking for people's views on vaccines and their plans to vaccinate eligible children, as well as feedback for the provincial vaccine program. This information will allow us to better address vaccine hesitancy by allowing us to target specific communities and help share information that will increase vaccine uptake. Collecting this information will also allow us to better understand the views of Manitobans so that we can implement new plans or adjust our existing plans based on public feedback. So starting today, Manitobans can fill out the survey at engagemb.ca. We know that many people are already engaged in the vaccine program. Our super sites and our pop-up clinics are delivering thousands of doses a day. We're also seeing some people who are in a celebratory mood when they come for their vaccine doses. And so I've been getting stories from the teams at our super sites and clinics about people arriving in prom dresses or costumes to get their vaccine. And it's been so fun to watch people who are so excited to dress up and come for their vaccine. I saw on Twitter, for example, somebody dressed up in a full Fred Flintstone costume to get his vaccine at the RBC super site. And these people just really bring a sense of joy and fun to the work our teams are doing at the clinics. So, thank you for bringing that when, so many of us are feeling so tired from this pandemic. I do want to remind people who want to dress up to make sure that you're wearing something that is short-sleeved so that we can access your arm. So a Fred Flintstone costume is a great example of something that is short-sleeved. So feel free to dress up as Fred Flintstone for others who may want to do something like that. In our conversations with some communities, we've heard that people are anxious that the vaccine might affect their ability to have children in the future. I want to be very clear on this point that there has not been a report from anywhere in the world showing that this vaccine has any impact on your ability to get pregnant or to get somebody else pregnant. The process of the immune response is completely separate from the process of getting pregnant. And so, we have been very encouraged as we've looked at the reports from other countries and seen that as 1.5 billion doses of this vaccine have been given, that no one is reporting any issues related to fertility. So if this is holding you back from making your appointment, I encourage you to talk to your healthcare provider to get good information about this. And we also will have information on our Protect MB website. We are in a race against this virus, against the variants, against the new variants that might come in the future. And we're seeing the devastating effects it can have on people, on our healthcare system, and on our healthcare providers. The third wave is very much here, and so we want everyone to take a seat in the vaccine clinic, roll up your sleeves, and protect yourself and protect the people around you. For those of you who have waited to make your appointment to see how this system would work, and we encourage you to call now. Our clinics are running so smoothly, and we want to see you there. I have one final reminder on behalf of the rest of the public health team. On Friday, Dr. Atwal talked about the challenges about whether or not symptoms right now might be related to allergies or to COVID-19. So I do want to encourage all Manitobans to err on the side of caution and take the online screening tool if you're showing typical allergy or cold symptoms. It can be difficult to tell them apart, and the online tool can help you figure out whether or not you should go for testing. If the results do recommend that you go for testing, please do so, and self-isolate until you receive your results. This includes those of you who have received the vaccine, but start displaying symptoms. We have seen people who are partially or fully immunized who display symptoms, but delay going for testing because they think that it's not possible for them to get the infection. So we ask again that if you're having symptoms, whether you've been vaccinated or not, to err on the side of caution and go for testing. We want you to be safe, and we want you to keep those around you safe, and going for a test is your best option at that point. So I know we're tired of the pandemic. We're all feeling a lot of exhaustion as we go through this. But getting the vaccine is something that we can do to help bring the case numbers down. Je sais que tout le monde en a assez de cette pandémie. Mais se faire vacciner, c'est quelque chose que vous pouvez-tu faire pour nous aider à faire baisser le nombre d'infections. So please call today to make your appointment. And with that, we will go to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Bart.
Hi, Dr. Reimer. Right now, there are approximately 6,800 doses of AstraZeneca from the first batch, up to 6,800. We don't know exactly. Your team doesn't know, hasn't said exactly, are slated to expire at the end of May. While I am aware that your preferred administration of the second dose of AstraZeneca is after 12 weeks, the medical label says, the manufacturer's label says, it is okay for people to get that second AZ dose after a month. Why won't the province let pharmacists and doctors administer that second AZ dose to willing and interested people before those doses expire in a matter of days?
Thanks, Bart, for that question. So we do still have doses that are at some of our pharmacies and physician offices, and some of them are set to expire at the end of this month. So there's no hard rule that says that the pharmacists and physicians can't offer doses according to the manufacturer's guidelines within Health Canada's approval. And we have been working with them to provide them with the best clinical guidance about how to use them to have the best possible outcome. And certainly the original discussions were where we were intending to use all of these for first doses. We're quite focused on getting the best outcome by waiting those 12 weeks where we saw that the AstraZeneca trial found better efficacy in those who were receiving their second dose after 12 weeks. But we are regularly communicating with the pharmacies and the physicians, and while we provide them with our recommendations, there are unique circumstances where people may benefit earlier from a second dose. And so the clinicians do have the ability to do an individual assessment and make a case-by-case determination of when the general recommendations from the province may not be best for the person in front of them. We are going to send out some more communication with them to more formalize some of the recommendations probably this week sometime. But we have been communicating with them on an ongoing basis on how they use the vaccine.
Thank you. That completely answers my question. Mr. Botha, I'm going to ask you again what I asked you this morning here. Sort of belabor the issue, but we are seeing, especially on Sundays, and we saw Sunday and Monday this week, dose administration, at least the recorded doses, below 10,000 a day. Can you explain to Manitobans just when we're averaging about 13,000, just under 13,000 doses a day, but we've got supplies that if you just do the straight division by 7 days, it looks like we should be somewhere closer to 15 or 16,000. Why is it that it appears by that math that Manitoba isn't administering all the doses it has on hand for a given week?
Thanks for that, Bart. And the reason is that while we administer the vast majority of the doses that we receive, Pfizer in particular, but also Moderna within a given week, we do have channels that still move slower, in particular our focused immunization teams. So while doses in arms quickly is the name of the game, certainly for super sites, and more so for our pop-ups as well, our focused immunization teams are going into often complex locations geographically, but also complex facilities and the range of congregate living facilities that they tend to visit. These are small teams. They take a relatively small amount of vaccine with them. But they do take longer to go through all their doses, by no means much longer. Most of ours, you can see on the deck that we put out every Wednesday, all the doses that we have under our channels tend to be out at most within a week and a half, and that half above and beyond the week are those fit teams that are administering those doses. Maybe to just do some specific numbers, this week by Sunday we should get around 73,700 Pfizer and 37,600 Moderna. So it's about 111,000 or so doses. Next week we're going to do almost 100,000 doses in a week. So that's 90% of those doses in a week. But that said, we're not going to take away that few doses, about 10,000, that's going to very vulnerable areas, just so we can race them through that week as well. We still need to be looking at those Manitobans who need them in the congregate living facilities.
From the Canadian Press, Steve.
Dr. Reimer, your comments about the soon-to-expire doses of AstraZeneca, it sounds like a small amount is involved if we're talking about a case-by-case basis that clinicians can follow. Realistically, how many doses are you looking at in terms of potentially being thrown out?
Yeah, I don't think we have a clear estimate of how many people might move forward with dose 2 AstraZeneca, given some of the uncertainties around the overall plans for moving forward. We have 500 different partners in that channel, and so it would be challenging for us to get a clear estimate from all of them so that we can understand how many doses they think they can move in that way. What's really critical from our perspective is that they're doing what's best for the person in front of them. And so having that careful, informed consent discussion about the fact that doing an earlier dose might decrease the effectiveness of that second dose overall, but certainly there's some benefits to getting it earlier as well for some individuals. And the uncertainty around whether or not other folks who got AstraZeneca might be offered an mRNA vaccine in the future. But if the individuals, despite knowing those facts, still want to proceed, that's something that we're working with the pharmacies and physicians to be able to provide.
And so how many AstraZeneca doses are on hand now that are expiring at the end of this month? And ballpark figure, how many do you think might be at risk of being thrown out?
We don't have the exact number based on the expiry date because that's not something that is tracked in the Public Health Information Management System. And so we do know what we received in our original inventory, but when the physician or the pharmacist enters the administration data, they don't put in the information about the expiry date. So apart from doing a count of the doses at each of the 500 sites, we're not able to get an exact number for how many have the May expiry date and how many have the June expiry date. As a ballpark, we might be expecting that somewhere around half of them are expiring at the end of May, but that's truly difficult for us to quantify further than that because of the way the data gets entered in when those doses are administered.
From CTV Winnipeg, Michelle.
Hi, Johanu, you said mainly first doses will be administered, or second doses, sorry, will be administered during time of first dose. What else would come into play there for timing for second doses?
Sorry, Michelle, I didn't quite get the question. Can you ask it one more time?
So you said mainly the first dose time will determine when people will get their second doses. So what else will factor in there other than that?
I see. Sorry, I see what you're saying. Yeah, so yes, you're correct. Mainly the individuals, clients, Manitobans will be able to go book their second dose appointment based on when they received their first dose. And that will be what we use going forward. When I say mainly, I certainly just don't want to lock the medical team into a certain way of releasing second dose groups if there's new evidence that comes out that suggests that a particular group may need to get first in line, as it were, for a second dose. So it's the plan that we have going forward. It's nice and clean. I think it's easy to communicate. It's also got the eligibility from the first doses baked into it by virtue of the fact that those who got their first doses first were identified as either more vulnerable or needed to get the dose, that first dose, before others. So that is the plan going forward. I just say mainly because as we've seen throughout the vaccine rollout, we need to be flexible, and I certainly want to give Dr. Reimer and the medical team an opportunity to pivot, to say, instead of saying everyone now before April 15th, for example, can come for their first dose. Let's pause on that group and say that, this group X, Y, or Z may have to come, be able to book first. It's just to give our team that kind of flexibility should it be needed.
Thank you. Dr. Reimer, what will be the time between first and second doses? Some of the people who are maybe prioritized in this health conditions group may have just got their first dose or just got it, a week or two ago.
Yeah, so we have to stick with the manufacturer's minimum dose interval. The way that the studies were done is that not that they found the ideal time for dose 2, but that they were really trying to find what was the minimum interval where you got a strong immune response. Because we know that if you give one dose on day 0 and another 3 days later, you're not going to be boosting your immune response, and that second dose is not effective. So when they chose 21 and 28 days, that was done to try to identify what was the shortest amount of time where this second dose would really boost the existing immune response and not just become part of that first immune response. So we can't go earlier than the 21 or the 28 days because we risk substantially decreasing the impact of that second dose, but we can certainly go longer than that because we know from some of the data around other vaccines and possibly from some of the very early data even around this vaccine that waiting longer tends to give you a stronger immune response after the second dose. So even for those people who are eligible for dose 2 right away, they'll have to stick with the minimum interval for that vaccine type, so 21 or 28 days. And most people won't be eligible at that point because we'll be starting with those folks who got their doses, apart from the health conditions, in January, February, March, who for whatever reason didn't have their second dose at that time. So there'll be months in between doses. But as we get further along, that interval will certainly get smaller because some people will be getting their first dose at the beginning of June and their second dose in July.
From CityNews, Mike.
Hey, good afternoon. How would an info campaign target someone who isn't, say, hesitant to get a vaccine but just chooses to either wait on getting a vaccine or maybe they're procrastinating? Is there an idea of how you would target that group of people?
I think that's the exact sort of information we're hoping to get out of our Engage MB survey and that our communications team is working on right now. I'm so thankful that we have these folks who have so much expertise in communication who can help build those campaigns to reach a variety of different people with messages as well as platforms that are more tailored to different groups. So I don't have any specifics about what the campaign will look like because we really do want it to be informed by Manitobans to make sure that it does make sense and apply to what their experiences are. So whatever we create needs to wait for us to get that information from Manitobans.
And my follow-up question, it's a little wordy, so apologies if I get lost in it. How does the task force plan how much of a stockpile they need to keep in freezers to meet the expedited schedule of the second doses that we're aiming for, while there's still the variable of not knowing how many people who may have been hesitant at one time but now want their first dose? Like, what happens if there's a rush of remaining people who suddenly want their first dose while all the second dose appointments are coming through? Is it something that the second dose appointments will be pushed back, or how does that work?
Yeah, no, I can take that. So we don't hold back a stockpile. We assume a 70% uptake rate, and then we plan accordingly. So we have supply coming in through a confirmed ship and delivery schedule. We base the appointments that we build on that shipment coming in. And we have the corresponding capacity to pump that supply out, and that's what we use to plan ahead. We don't, and then as it comes in, as I was just talking to Bart about, for the most part we get it out within a week. Our planning for the second dose it comes from, one, projections from the federal government showing us how much will come down the line, and then the confirmed shipment delivery schedules, which allows us to build appointments from there. So we're comfortable that we have the supply to administer first and second doses. The issue is just when it comes in. It's not like it's all sitting here and we can just pump it out as fast as we can. It still comes in by week at a time. But people, Manitobans, really taken up the first dose is what we want to see. But we can have Manitobans book enthusiastically for the first dose, and we should still be able to run out our second dose campaign within the timelines that we've given.
From CHVN, Taylor.
Hi, good afternoon. Should parents be preparing to pull their teens out of school when they're ready for that second dose? Earlier it was mentioned that there's a possibility of doing some in-school vaccinations.
Yeah, so at the moment, as we said before, for the youth, our strategy is to use our larger pipes, our bigger channels, mainly super sites who are administering Pfizer. In cases in the north, we'll be looking at Pfizer-supported pop-ups or focused immunization teams. But the goal right now is doses in arms fast. And so youth are using and seem to be, for the most part, enjoying our super sites. So that'll be the approach in the short term, and certainly for the second dose campaign. We do have appointments available. More and more so, certainly inside the city, 7 days a week, full days, 12-hour days. So not necessarily having to, people don't necessarily have to leave school. But that is the approach at the moment for the most part. We will look at more tailored approaches for youth for whom it is just not reasonable in any way to attend one of these sites. And then, of course, after the second dose campaign, we'll look at what, if we need to do third doses, what that will look like.
Thanks. And this question is for Dr. Reimer. If we see vaccine hesitancy in some communities, and it is unlikely that they're going to get that 70% herd immunity, what would the vaccine task force next steps be?
Well, I think we're going to do a lot of outreach to different communities. We've already started to meet with a lot of community and religious leaders to get their feedback on what they're seeing and experiencing, but also to provide them with the tools and information to be able to be that trusted voice in their community. Certainly, we're not going to see a 70% uptake in every single section of Manitoba. And we know that that's a possibility depending on how we cut the data. But our goal is to get above 70% in every age group, in every community, in every health district to the extent possible. But at the end of the day, I mean, first shipment in Manitoba. So we are going to take a little bit more time as we wait for those folks to hit their 12-week mark, and hopefully we'll have that UK data available before making that final decision about what people are eligible for dose 2. So that's the approach for the AstraZeneca. Can you repeat the second question again?
Sure, yeah. The second half of that, I was just a little bit confused by your comments saying that there's like clinical guidance that can be used to perhaps offer a second dose of AstraZeneca to somebody before that 12-week mark. So I was just wondering if the province has given the green light to those providers to do that if the client asks for it.
Yeah, we're preparing some communication to clarify the process with providers, and so that's going to be going out at some point this week. What I can say today is that providers have always been able to do a case-by-case analysis because there are some situations that, because of their assessment of the person's health and the best interests of that patient, that they may have to deviate from the overall guidance from the province, which is one of the strengths of that part of our model, where we have clinicians who can do that case-by-case assessment of the needs of the patient in front of them. So the communication will be going out to providers to clarify more what they can or should be doing in regards to second doses this week. But for now, we're asking them to continue to use their clinical judgment when the best interests of the patient might differ from the overall provincial guidance.
Thanks, and thank you very much. And then my second question is I'm wondering whether increasing pressure on the acute care system due to COVID, the redeployment of medical staff that we've seen in recent weeks, and even higher COVID rates has impacted the operations of the rollout, and what plans are in place to make sure it isn't slowed down because of the increasing pressure on the healthcare system, and that canceled appointments are filled.
So I can speak to one side of your question. I think I wouldn't say there's a direct correlation between the impact on the health system and the pressures the health system are facing at the moment and the vaccine rollout. We've built our system, in particular our workforce, from the beginning to not we certainly use many individuals who are from the health system, but not to overburden the health system with our workforce. And the large numbers of our workforce, if you look at the 1,000+ navigators, the many clinic managers, support staff, these aren't clinical roles, so we can keep chugging along quite comfortably with a large percentage of our staff not being clinical. And those that are, we've been as careful as possible not to overburden the health system by recruiting them in. And then in terms of, I don't know if this is part of your question, but in terms of COVID itself impacting our operations, I think just by the nature of building clinics, infection prevention and control is the name of the game, and we, as a workforce, we probably have some of the more robust and established protocols and procedures for keeping our workforce safe. So we haven't seen impacts in that regard either. Dr. I don't know if you want to add anything to that piece.
No, I think that's a great summary. I mean, really, for the most part, the clinical teams that work in the vaccine clinics are not the same teams who are working in the ICUs, for example. So certainly public health is experiencing additional stress because of the additional cases, but most of the folks that have been recruited through the task force to work in the clinics are much less affected by what's going on in the acute care system.
From Global News, Brittany.
Good afternoon. At this morning's technical briefing, we talked a lot about vaccine hesitancy, specifically in southern Manitoba. I'm just wondering if you can talk to us a little bit about the reasons that we're seeing for vaccine hesitancy in some of these communities and what's being done to combat it. I know this morning we talked specifically about some of the Mennonite communities and Indigenous communities.
Yes, we've had conversations with some some leadership in southern Manitoba, and so, taking some of their observations around, long-term concerns about vaccines and/or even trust of government. There's a long history in the Mennonite community going back to Russia of experiencing harms related to government. And so I think some of those sentiments stick around for generations. And it's no different for Indigenous people who have experienced a long history of harms related to government. And so we are trying very hard to reach out from the government perspective, but also from more trusted local leaders. Because we know that for some people, messages from the government are not going to be the ones that reach them. So that's one of the observations that we've been told from people there, as well as just a lot of misinformation. There's many different sources that people go to get information about vaccines. Some of them provide factual information and some of them do not. And so we hear a lot about the different questions that people have or concerns that they have that are not consistent with the science, but make people feel anxious nonetheless. And so we want to try our very best to reach those communities to address any questions that they may have that we can answer with any of the scientific studies to give them that confidence to fight against any misinformation that is being presented to them.
Thank you. And as we're getting a larger number of vaccine doses coming in, we have already started to book those, 12 and older. But are we going to start to prioritize second doses for elderly who aren't living in long-term care homes to get them that second dose, as they might be more vulnerable without it than, say, a 20-year-old who doesn't have a first dose?
So I can take the first part of that. The way that we are moving through our second dose eligibility will replicate the eligibility that was built into the first doses. So in first dose, we by and large went by age. So elderly Manitobans, those in personal care homes, of course, but elderly Manitobans outside of personal care homes were eligible before younger Manitobans were. And so that will mean for the second dose, they will be eligible before younger Manitobans as well. Except this time, instead of calling out the age, we'll call out anyone who had a first dose before, for example, March 29th. And then we will look at how the appointments fill up, and we'll say that everyone who had their first dose before March 5th. And that by virtue of doing that, elderly Manitobans will be able to book their second doses before younger ones. So it's sort of baked into that process. Dr. Reimer, anything that you want to add in terms of eligibility?
Yeah, you asked about first doses for younger people versus second doses for elderly. And one of the approaches that we're taking has been all along that the first dose offers the largest benefit compared to the second dose. And so getting first doses into as many Manitobans as possible is beneficial not just to the younger people who may have a lower risk of severe outcomes, but is also beneficial to everyone around them, including elderly Manitobans who might have to wait longer for a second dose. Because if we can reduce the amount of virus moving around in the community, that has very large benefits for elderly Manitobans, even if it means that waiting longer for their second dose, because what we saw in the studies showed such good protection after dose 1. So the studies, particularly the ones that were done in Canada, were looking mostly at elderly Canadians and some healthcare workers, because that's who was receiving doses at the time those studies were done. So even with most of the participants in the studies being elderly, we still saw that 80% protection that led us to delay the second dose in exchange for getting more first doses in. So that doesn't change now that we're hitting even younger populations. We still value the ability to reduce disease transmission as our number one priority in this rollout, and then providing that boost or that longer lasting immunity with the second dose being our number two priority that we are excited that we get to start so soon.
From the Brandon Sun, Colin.
Good afternoon. I think this question will probably be for Dr. Reimer. In Europe, I see that there's some experimentation and research being done into seeing if the Pfizer vaccine can be stored in refrigerators for a longer period of time than was originally fed. I was wondering if this is something Manitoba or Health Canada is looking into that you're aware of.
So Pfizer has indicated that they will be or have already applied to Health Canada to extend the amount of time that they can that the product can be stored in the fridge. I can't recall off the top of my head if they have already applied or if they are about to, but they certainly have indicated their intention to do that. And given what we've seen in other jurisdictions, my educated guess is that Health Canada would approve that, but I don't work at Health Canada, so I can't provide any sort of confirmation of how they might respond to that information. But the intent from Pfizer is to apply to change the storage rules so that the Pfizer vaccine could be in the fridge for up to 31 days. And so that would be a massive benefit to our rollout, to have the flexibility going from 6 days to 31 in the fridge, and would really give us more ability to use Pfizer in a larger variety of settings in the future. So we're certainly hopeful that this application gets approved, but also respect the difficult work that Health Canada does to make sure that every approval that they do is going to be safe and effective and reflect the best science that's presented to them.
Thank you. I was also wondering, with the second dose rollout starting shortly here, I know that health conditions and people taking certain medications are being prioritized first, but is there any chance that the province and public health might start prioritizing certain health regions or certain communities over others if case counts start to climb in certain areas?
I would say nothing's ever off the table. We're right at, I hope, the peak, maybe hopefully just past the peak. That might be wishful thinking, but the peak of this wave 3. So the information coming in is quite new. And so our team is looking all the time, every day, to see if there are certain trends of groups, whether it's different communities, different ages, or any other way to identify people that shows that the first dose is not leading to as much protection for that group as others. And if we see a clear group where that first dose is not providing sufficient protection, we would add them earlier in the eligibility. But mainly the approach is going to be the timing, because it already includes all of the work we did for prioritization with dose 1. And all of the scientific analyses and epidemiologic analyses that we did with dose 1. And we want to take advantage of all that work in a way that's easy for Manitobans to know when it's their turn. But yeah, nothing's ever off the table, and if there's something that becomes very clear to us, we would add that group in.
From CJOB, Clay.
Good afternoon. Dr. Reimer, just to clarify, for the start of the second dose bookings that start Friday, this is just for those who have received the Pfizer Moderna vaccine and not AstraZeneca?
So at this point, for those people who have received AstraZeneca, we're recommending that they wait 12 weeks before receiving a second dose, regardless of which second dose we're going to offer them. But our team is going to take that away and come up with a final decision before Friday about that. So for today's announcement, it would be people who received Pfizer or Moderna, because we want to provide the same product for dose 2. And before the bookings open, we'll have a recommendation temporarily for folks who received AstraZeneca for dose 1, but recognizing that that temporary recommendation might need to shift when we get the UK data. So our approach today is to stick with the same product for dose 1 and dose 2. So that means that those folks who have had AstraZeneca are not yet due for their second dose.
Okay, thank you. And this may have already been asked, but are we seeing more young people coming in to be vaccinated?
I'll take booking piece. I'll pivot to Dr. Reimer in terms of actual uptake. I think it might be early days for that, because they've only been eligible for such a short period of time. But what we can tell as sort of an early potential indicator of enthusiasm amongst this group of Manitobans, young Manitobans, is the aggressive rate at which bookings occurred on May 14th when youth became eligible. We saw just under 42,000 appointments made that day. Historically, the appointments made on any given day are made by those who just became eligible. So we're assuming and probably correctly assuming that the vast majority of those appointments were made by or for young Manitobans. And if there's 111,000 or so young Manitobans, and almost or under 42,000 of them, or almost, assuming there's some non-youth that booked, that's a massive chunk. That's a really, really big chunk who are anticipating to get a dose in an arm. And I think that's really good news. But in terms of the concrete uptake and any potential confidence, hesitancy issues, over to you, Dr. Reimer.
I'm actually going to go back to the first question because I wanted to add one other aspect. The case-by-case examples that I was mentioning before about dose 2, the people with the health conditions where they may not mount a sufficient immune response after one dose is an excellent example of where the clinicians might deviate from the provincial recommendations and provide that second dose. So some of these individuals who are in the health categories that are becoming eligible for a second mRNA dose have already or could talk to their provider about getting a second dose of AstraZeneca prior to the 12 weeks.
Our final reporter this afternoon from the Winnipeg Sun, Scott.
Good afternoon to both of you. The first question is, so there seems to be some confusion on vaccination and still attracting the COVID virus. Having listened to this, I know the answer, but can you explain to people that infections that can still happen, even if there is a vaccination in place, even if 2 vaccinations, if you are fully vaccinated? Can you explain that vaccinations infections can still happen despite vaccination?
Absolutely, and there's really 2 different aspects that people need to consider. The first is that the immune response is not immediate. So it takes most people 2 weeks to build up all of those antibodies that would be able to fight off the virus. So for the first 2 weeks after you receive a dose, you should assume you have no protection at all, because for most people it does take those 2 weeks to build up any immune response. And so most of the infections that we see after vaccine are those that are actually occurring within that 2-week window. There are some individuals who might take longer than 2 weeks. We know one of the studies from Quebec showed that maybe even 3 weeks might be more realistic for certain groups of people to be considering not protected. But for the majority of people, 2 weeks is a good estimate, but longer is better. Even if you are someone who mounted an immune response in the first 2 weeks, that immune response likely continues to grow for several weeks after that, and your ability to fight off the virus gets stronger over the weeks after that dose. And then the second thing to keep in mind is that none of these vaccines are 100% effective. So even if you've received 2 doses of the vaccine, and even if we're looking at the ideal situation of the study protocol where everything was controlled and we knew exactly when people got, exactly how much they got, and who got it, they still had 5% of people that did not end up being protected. So even in a perfect setting with a very effective vaccine, some people won't be able to fight off the virus if they're faced with it after 2 doses. That's one of the really big reasons why we wanted to make sure we got as many first doses in as possible, because nobody knows whether they're in the group of people who did have that strong immune response or if they're in the group of people who did not. You don't feel any different if you've mounted that immune response or not. And so you don't know if you're one of the folks who's protected or not. And so making sure that as many people around you as possible are also protected and not able to or less able to spread the virus is really important to protect even the vaccinated people. And so we want to get as many Manitobans immunized as quickly as possible so that we start to protect each other. So that not only are the people who haven't received a vaccine protected when everybody else is immunized, but even those of us who have received the vaccine are protected just in case we're one of those folks who don't have a strong immune response. And so we're seeing our early data in Manitoba has been so positive and encouraging in what we've seen in our hospitalization, our ICU data. The number of people who are coming in after 14 days or more after being immunized is very, very low. And so that's very encouraging that this vaccine program is working, that we are saving lives, but it's not 100%. And so there are still going to be some people who end up infected, and some of them are going to get very sick, but the numbers are so much lower. And the more we protect Manitobans, the lower those numbers go, even for those people who aren't protected by the vaccine.
And this concludes our media briefing.